It's actually been a great partnership, and to see the technology that's harnessed, the tools that are available to the providers, specifically the revenue cycle management team, to administrators, owners, to look at dashboards and really utilize the data, to look at the clinical data for the MDS and OASIS tools that are available that can focus on 5-star, and some of the other quality metrics are really important for relationships with payers as things move forward with our value-based care focus, both nationally and in a regional type of setting with those payers. And providers really need to focus on the outcomes and understanding their data. And that's where Inovalon does a really good job at pulling together that data so that it can be understood, so that metrics can be utilized to focus and project for the future, and to set goals and make plans on how they're going to adapt. The future is now, and some providers I find dig their heels in and they're not ready to embrace technology, and that's where Inovalon is right in sync with where providers need to be to position themselves for the future, with payer relationships, with making sure that they're collecting all of their money by having claims go out, utilizing the data available. Claims Management Pro specifically is able to have the dashboards to see on an overarching view of all the claims going out. At the same time, the built-in edits that are available, the event tracking, so you can actually look at the events and the life cycle of that claim and where it's hit, when it actually came into the system, when it was released out to the payer, was it acknowledged? Users are able to make the edits at that point in time that it's rejected, for example, or denied on a remit, so that it can be reworked. And the data and the dashboards for rolling up monthly and other filters that are available is really, really useful to a revenue cycle manager or a provider looking historical data filtered down to a payer level. Also for particular time frames, there's just a lot to be gathered through Claims Management Pro. The eligibility workflow is great for intakes, referrals across the whole provider spectrum. And that would include, hospitals, home health, skilled nursing facilities. Their intake and referral department really is able to look at the benefits that are available for the particular patient or resident that's being readmitted if it's a long-term care facility, to look at that eligibility real time, and some of the integration that is available as well to look at the demographics and have specific details that they might not have. If they're looking up based on social security number and date of birth and name, then the eligibility workflow is going to give additional details. The eligibility and the intake process is absolutely critical to the downstream claim submission and getting paid as quickly as possible. By that claim going out with accuracy, with data, and really on the front end, not just that eligibility, but also so that the intake and referral team can get the correct authorization, work through the correct benefit plan, especially during an open enrollment time. People forget that they made a change in benefits. They might have ended up in the hospital and not realized that they enrolled, and now they're shifting to a new benefit plan and they've crossed over that month of that effective date. So the patient very well might give the incorrect data, and that's where the demographics Inovalon solution also makes a huge difference. Just from that patient demographics, it goes out to look at that particular individual. It might even pick up long-term care policies that people forget that they have signed up for in years past. They've been paying the premium for a policy, and lo and behold, now they're in the setting that they can actually see that return on investment. Analytics when it comes to those post-acute environments would be the MDS analytics that are available can really help a provider position themselves with the CMS 5-star, with some of the QRP, the quality reporting, and understand the clinical capabilities of their provider based on the patients that they've taken care of in the past. And I think that's an area that providers really haven't focused on or looked at. I think they're kind of caught in the hamster wheel of just doing what they've always done. And they need to realize it's time to utilize technology to shift the gears, to look at the analytics that are available based on their specific provider data and be able to make some decisions based on that. From utilizing Inovalon specifically with the claims management piece, there's definitely options and proof is right there that they can actually reduce FTEs by utilizing the data that's available, looking at the claims, being able to automate some of that process. Believe it or not, there's still people that are mailing out claims these days. And that's where there's some of the enrollments with the payers, even with some of the work comp and some of the other payers that still want claims paper, there's efficiencies and functionalities there. In addition, something really important to hit on is the appeals and the denial management. So to be able to do appeals right through the Inovalon platform as a solution to cut down on paper and the time and the mailing fees and everything else, there's just a lot to be said for that.